Coming up, we'll be on location at Bathurst Family Therapy in Woodstock, Maryland, discussing advances in sexual therapy and how it can effectively help improve your sex life, relationships, as well as your overall well-being with one of this region's top doctors, Dr. Stephanie Bathurst. Welcome back, Dr. Bathurst. It's a pleasure having you on again with us.
It's a pleasure to be here. Thank you.
Your first interview is helping so many folks around the DMV region and beyond, and we just had to have you back a second time. So I wanted to ask you if you could please begin by telling us about your background and experience within this modality, because you are a clinical sexologist as well.
Absolutely.
Yes.
When I started in the field, I specialized in the treatment of children with advanced sexual trauma. And within the first 2 years, as intense as that niche is, as important as that work is, because of the intensity, I started transitioning more into outpatient care and started specializing less with children and more so with adults.
Oh.
Still working predominantly with sexual trauma recovery.
And what would you say are some of the most common issues that you're seeing in your patients and clients, Dr. Bathurst, that can occur in sexual relationships?
When I transitioned into the outpatient sector for treatment of adults with sexual trauma, I started working with non-traditional relationships and sexual assault recovery, and that's when I started working within the kink and polyamorous community. And working with that community pretty predominantly led me to seek out an advanced degree in clinical sexology, which is where I also got a certificate in kink-aware therapy.
Okay.
So I started and founded my private practice, Bathurst Family Therapy, in 2014. And that's kind of where I am today.
Yes, indeed. And this is one of several areas within mental health that you certainly have a lot of expertise in. And for those other areas, folks, we covered that in the first interview.
We did.
Yes.
We did. Yes.
So back to this interview, Dr. Bathurst, and I appreciate you sharing that with us on the background and how you evolved into this specific submodality as a clinical sexologist. And I wanted to ask you, Doctor, if you could be kind enough to tell us what are some of the most common issues that you see occurring in our sexual relationships?
Sure. So sexual pain disorders, predominantly in women, and that accompanies emotional turmoil and distress, both for the individual experiencing it and relationships, and anxiety conditioning, which tends to amplify the pain disorder, mismatched sexual styles or preferences within relationships, pornography, masturbation, or sex addiction, or impulse control disorders is a different way of saying it.
Sure.
Low or no libido, particularly for women. Those are the most common ones that I see in my practice. Yeah.
And what can cause them to occur?
For sexual pain disorders, pelvic pain disorders, particularly for women, it can be a number of causes. Sexual shame embedded in cultural, religious, or familial backgrounds, anatomical complications or miseducation for sexual positions that's causing pain. It can be pelvic floor instability. It can be any number of things.
Yes.
For sexual impulse control disorders or addictions, sexual addictions of any kind, I find that usually they're embedded in performance or anxiety disorders. And usually when you have an anxiety disorder or an impulse control disorder that is also habituated with some degree of sexual stimuli conditioning, you see a very rapidly evolving dependency. So it's kind of like a perfect storm that
Yes.
evolves.
Now, how do you diagnose these issues? I know in the first interview we did with you a little while back, you were talking about the initial evaluation process that you have with your patients and clients. I'm sure the same would be applicable here as well in this subspecialty.
Yes, yeah. We use the DSM criteria.
Yes.
We evaluate the various life domains and disruptions or dysfunctions associated with them, the degrees in which the client's quality of life has been impacted, and in comparison to what they are wanting to experience out of life. We also focus on various patterns. So we look at hormones, nutrition, seasons.
That's where your integrative approach comes in, right?
Yes, medications or pharmaceuticals,
Yes.
right?
You kind of look at everything, you look at each of your patients from that holistic perspective
Yeah.
to see how some of those areas could be tied into some of these issues.
Yeah, it's really wild that when you look at the whole picture, when you look
Yeah.
at the full system, the things that you can see really are related to one another and
right.
impact one another.
You're-
It's amazing what is in like what affects one another. Yeah.
Yes, indeed. And I was going to ask you as well, Dr. Bathurst, how do you determine the most effective treatment options to help these individuals and couples when they initially come to you? Is that all determined through that initial evaluation and the DSM process that you talked about?
Some of it is determined in the initial consultation and evaluation process.
Yes.
And then some of it is as we go along. Some of it is personality, right? If I have a client contact me and they have a really intense personality, they're hyper focused and very solution oriented, and they're very directive, I know that they are not going to be a client-centered modality. They're not going to be a good fit for that because that is a very like soft, less directive kind of
Yes.
approach. That is not their style.
That's not going to work for that particular type of client.
No, they are
Got it.
going to be very unfulfilled with that approach, right? And I'm upfront with them
Yeah.
about that.
So that's what I love is that you really get to know each of your individual clients and patients, not just through the eval process, but as you just said, as you kind of go through, start that process together, right? As you learn
Yeah.
more about them and you realize out of the many tools that you have in your toolbox, what would be better suited to help this particular individual based on things like you just mentioned, their personality, for example, as opposed to another patient of yours.
Right. It's not just a
Not
cutout
cookie cutter.
experience.
Yes.
Exactly.
It's
Yeah.
all customized
Absolutely.
to help them achieve their goals.
It should be. That's what
Yeah.
gets you the best results.
Yes.
Yeah. As part of my process, as part of the treatment process, I like to incorporate resources. So an example would be body positive and sex positive education sites like dodsonandross.com, right? Which is a really wonderful tutorial website that clients can go to better understand their bodies and to better understand their partner's bodies. So these are examples of treatment approaches that I use in conjunction to our in-person sessions.
Yes.
So
Well, working hand in hand with the
Yes.
in-person and the tools that are available online that you recommend as well.
it should be,
All working together
yes,
to help those particular individuals.
absolutely. So as part of the protocol that I implement, my goal is to treat the whole system, right?
Yeah.
For example, if I have a female client who is coming to me with the presenting issue of low libido, and she's manifesting with anxiety, and she feels that is completely unrelated to her low libido. I know that it's not, right?
Yes.
That they are very much interwoven. What I would recommend, in addition to visualization exercises and positive body conditioning, physical stimulation exercises that we can talk about, in addition to those, a really high quality vitamin D, omega-3, and methylated B complex vitamin. So in addition to those, having at least 2 minutes of sunset and sunrise light on her face, and if she can't, because of when she wakes and when she goes to bed, if she can't get that on her retinas, getting a red light box so that she can regulate her ultradian rhythms, which can reset her nervous system. So what that does, because the libido and anxiety are on opposing nervous systems. Okay, so if she's having heightened anxiety, which works off of the sympathetic nervous system, so if anxiety is on, libido is off. Okay, so we need to deactivate anxiety, which is the sympathetic nervous system, so that we can activate libido, which is the parasympathetic nervous system.
Makes perfect sense.
So that is the whole system, right?
Yes.
Working with the whole system.
Yes.
That would be an example.
And that's where your integrative medicine background comes in as well, as you just said.
Yes.
You even, including the red light therapy that you offer.
Yep.
And I wanted to also ask you, how many treatment sessions are typically necessary to achieve optimum results in your clients? And again, I know that depends on each particular individual, but generally speaking, what have you seen over the years?
Sure. I'm going to give you a couple of presenting issues and the average, just to kind of gauge. So for performance-based ED, I would say the average is around 10 sessions.
Okay.
For pelvic pain disorders for women, the average, and this is a big spectrum, between 3 and 20 sessions, and that's because the underlying core reason for that can range from severe trauma in childhood to poor muscle tone, right? So those are very different reasonings, and therefore the treatment protocols are very different.
Obviously, the one that's more severe would take a
Much
number of
longer.
more sessions over a longer period of time, as opposed to something like muscle tone, for example.
Which is just like,
Yes.
yes, exactly.
That makes sense as well.
Yes. And then rebalancing initiator roles of sex within a relationship usually takes about 4 or 5 sessions because
okay.
it's more logistics based and it's very action oriented with exercises.
Yes.
So I hope those examples are helpful.
Yes, indeed. Now, can these sessions be conducted virtually as well, Dr. Bathurst, with your patients, or do you give options of in-person as well as virtual? I'm sure depending on what's convenient for your clients, right?
Yeah, so I have, my office here is in Woodstock, Maryland, so I, of course, do offer in-person sessions. I offer hybrid sessions as well. A lot of my clients prefer to stay virtual, but because of COVID, out of necessity, even our bodywork programs, our somatic programs, had to have been skillfully adapted to accommodate virtual sessions. So absolutely, everything can be accommodated to be offered in a virtual capacity, which is wonderful because it allows us to offer sessions globally to clients across the world.
And you're
And we
helping
are.
folks everywhere, worldwide.
Which is amazing.
Yes, absolutely. And now the next question I'm about to ask you, I know depends on each patient and client and how much they're also following the plan that you outlined for them after the initial evaluation. But typically or generally speaking, what type of results are your clients seeing?
I would say as long as, again, we are fully invested, there is a degree of frequency to our sessions, especially in the beginning of the process, because we do need consistency to kind of get the momentum going, especially as we are trying to disrupt some of these feedback loops of unhealthy patternings. As long as we are able to meet with the recommended frequency, especially in the beginning of sessions, we're able to complete the provided exercises, worksheets in between sessions, the results can be dramatic and rapid.
That's certainly great to know as well. And again, I totally get what you're saying regarding you and your client and or patient coming in with the frequency that you initially outlined in the sessions, because if the frequency is not there, then it's like you're literally having to restart it on each session that may be too infrequent in between sessions, as opposed to the level of frequency that's required to help them with that particular issue or problem. So that way, each time they achieve a step or take that next step, you can help them continue to build on those steps moving forward as they come to you with the frequency that's needed for that particular issue.
Absolutely, yes, yeah.
Can these issues recur?
Unfortunately, yes. Our bodies are built to retain memories. Somatically, like in cases of chronic pelvic contraction, pain can return if maintenance exercises aren't continued with a degree of regularity. So we do need to be mindful of that.
Yes, indeed. Well, on that note, doctor, we are literally out of time, but I just wanted to ask you, you and your practice, Bathurst Family Therapy here in Woodstock, Maryland, have certainly achieved a reputation for excellence in patient care, client care. You're helping folks not only in the DMV region, but worldwide, as you mentioned earlier as well, through your online and virtual services. I just wanted to ask you what you feel really helps separate you and your practice apart from many of the others, because you've established a top reputation in the mental health modality.
Thank you so much for that recognition. We really appreciate that. I think a lot of what separates me and my practice from what a lot of the other clinicians out there are offering is the personalization and the privatization of the process itself. I truly work one-to-one with every single client. It is me and them working fervently to enhance their quality of life and make their relationship so magical and so fulfilling, to make sure that they are content and happy and experiencing the degree of joy and euphoria that they deserve. And we
Yes.
all do.
Yes, indeed. Well, you certainly are doing a great job. So many folks are coming to you from everywhere, and they love you. And that says a lot about you, Dr. Bathurst. And on that note, I'd like to thank you again for joining us, being a guest on our program. It was certainly a pleasure having you back on with us today.
Thank you. It was a pleasure as well.